Hey everybody, I'm Dr. Jason Barker with Rocky Mountain Natural Medicine, and today I want to talk to you about the difference between sensitivities and food allergies. So both of these are reactions that happen when we ingest a food. Food allergies is more of a violent type of reaction. You're going to vomit, you'll get hives, you may even get anaphylaxis. That's a very serious thing. We don't test for food allergies at our clinic. We'll refer you to an allergist to do that. But we do look at food sensitivities, and it's a bit of semantic difference there, but sensitivities are a kind of a chronic smoldering reaction going on in your body as a result of ingesting a food that your body just doesn't like for whatever reason. So you'll ingest this food, your immune system will react to it. That immune system releases chemicals called antibodies, and the antibodies bind up the antigen that's from the food protein, and you get a antigen antibody complex circulating around, and basically what that does is cause a lot of problems in your body. You can get things like skin conditions, eczema, psoriasis, acne as a result of a food sensitivity. In fact, in naturopathic medicine, we say that when somebody's skin is not healthy, you need to look inside of the body at what's going on. So food sensitivity is often a major reason why somebody's got a skin condition going on. Asthma, coughing, wheezing. A lot of asthma is, they disregard food as a cause of it, and they'll just wind up giving you inhalers and steroids to treat the asthma symptoms, but nobody ever looks at, well, why do you have asthma? So if you're somebody who's recently developed asthma, or even a little kid, you need to look at a food sensitivity. Things like brain fog, headaches can be caused by food sensitivities. Joint pain's a big one. I see a lot of that. Oftentimes people have kind of random joint pains. There's no real reason for it. They've gone to a rheumatologist who's a joint doctor. They've done all the required blood tests to look for something called rheumatoid arthritis. It comes back negative. They say, we don't know what's going on. We don't know why you have this joint pain, but here's some rheumatoid arthritis drugs, which are very, very strong and powerful to treat this joint pain. And not a good idea to do that if you don't have rheumatoid arthritis, but rather let's take a look and see if you've got some food sensitivities that are contributing to that joint pain. I found that in the 17 years I've been practicing, we've been able to get rid of a lot of people's joint pain by doing some food sensitivity testing and finding out what foods that their body does not like. So there are many, many other symptoms that we can tie to food sensitivities. So if you're somebody who's got some of these funky symptoms going on and nobody's really given you a real reason as to the cause of these symptoms, please give us a call or come on in and we can test you for these food sensitivities. We'll look at 96 different foods. So we look at all the major food groups, grains, meats, veggies, fruits, nuts, seeds, and then there's dairy products, and there's a couple other random food products in there, or food categories in there that we'll test. So 96 different foods is a lot of foods. Most people eat the same 10 food ingredients every week, so it is a very comprehensive test. One of our doctors can test you for this. When we get the results back, we'll go over that with you and look at what foods may be contributing to your symptoms, and we talk about how to take those out of your diet. What can you add into your diet that's good for you? And of course, we're going to talk about taking care of leaky gut. Leaky gut is always involved in food sensitivities, and so that's part of the deal of taking care of the sensitivities and getting the foods out, but we also got to heal the gut up. Okay, so if this sounds like you or somebody you know who's got some funky symptoms that nobody's discussed the cause of, give us a call, come on in, we'll test you for some food sensitivities and hopefully get you feeling better soon. All right, thanks for watching, and I'll see you again soon.